evening, ladies and gentlemen. I'm not sure where I should stand to be able to see the slides as well. To be sure, then thank you. First of all, thanks for the opportunity to share with you what Intel is doing in healthcare and what are our experience and knowledge from the overall ICT industry, which we are trying to apply and implement in the upcoming transformation of healthcare. It's the same in most of the countries, and as I got a translation of the opening speech also here in Romania, you are solving a lot of issues, how to transform healthcare. The situation emerged in developed, emerging countries, all the same. The population is aging. There is more and more people living longer and longer with more and more chronic diseases, which of course creates a push on healthcare funds and spending and refunding of the healthcare. Also, the rising costs of healthcare are being big issues. It's already being addressed that the cost is rising faster than the economy is able to rise. And of course, shortage of healthcare professionals, where it's being still discussed whether it's because there is more patients or it's because there is low healthcare professionals. I think both ways are the reason. All these three issues are pushing on creating new models of cares. The ultimate shift which we are seeing in the healthcare going digital is that we are already moving from acute care. There is already being a lot of interesting program with residential care introduced across many countries, but it's still not getting the benefits which the ICT can bring to the way how the healthcare is provided to the citizens. Intel has been involved already for a while in home care. Maybe some of you noticed that 2 years ago we created a spin-off company with GE Healthcare, which is called Care Innovation, and is solely focused on delivering secure platforms and solutions to be used in home care. But the ultimate goal, which is being now on agenda of many governments, is to change the way how citizens are treating their own health, because, well, in my country, in Czech Republic, a lot of citizens are treating their health like it's something that belongs to the healthcare professionals. They are not responsible for it. They do what they do, and if something goes wrong, they come to the healthcare professionals and saying, okay, now you take care. But of course it does not work this way. The health status is, our individual asset, and if this mind shift will not be done in population, then even the richest countries in the world will not be able to serve their citizens if they are not taking their individual responsibility for their health status. And now I ask you to start the first video, and sorry for that, because for some reason it does not start from the PowerPoint automatically. Within the last 10 years, the landscape, and not just in healthcare, has evolved pretty significantly. You've probably see those statistics that Facebook is already the third most populated, if it will be a country, of course, it's the third most populated country worldwide. And there are, well, okay, no problem, so please just jump to the second video directly, and we can save some time. Yeah. It has been already addressed that the interoperability is a big topic in healthcare, but as you see also the common softwares are not fully ready if you travel abroad. Despite it has been prepared in PowerPoint, it's for some reason. Perfect, thank you. And you can switch off the sound if possible, so I'm not overshouting it. Thank you very much. The changes we are seeing in the overall population are, of course, influencing the healthcare environment a lot as well. There is being already defined so-called Health 2.0, which reflects on using the tools of Web 2.0, which is usually a group of tools like social networking, search engines, and various other things where the content is created by the users. It's not anymore created by those who are publishing it, but Web 2.0's platforms are enabling each of us and each of the citizens to create, post, and publish the content he thinks is worth to share. And of course, it's influencing the healthcare environment. There is more and more physicians or healthcare professionals using these tools for their continual medical education or for the communication with their clients, with the patients. And if we take, can we go back to the PowerPoint? Thank you very much. Yes, one more, and one more. Thank you. This is the schematic picture of Health 2.0 environment. The triangle connects healthcare professionals with biomedical research, and on top of that, of course, is consumer or patient, depends on the point of view. I would like to point your attention to, because in many countries, electronic medical records or personal healthcare records are right now presented by the politicians as the ultimate goal where we are heading to have the digital healthcare. But in fact, these tools or solutions are just part of the overall picture which the ICT is now putting to healthcare environment. Another very important, or let's say very new thing which is changing the relationship between patient and healthcare professionals is so-called apomediation. That's a process which is totally changing the information balance between healthcare professionals and patients. Last 5,000 years, if we count it from old Egyptians who started to create something what later on has been called a medicine, the healthcare professionals or the medicine men in the Middle Ages were having kind of information monopoly, or at least they had more each time they had more information about health and diseases than their clients, their patients. With Web 2.0 and the apomediation process, this information disbalance, which traditionally is in favor of healthcare professionals, is not just getting equal, it's even turning the advantage of more information to the patient hands, because within apomediation, the patient can really study and go vertically in the knowledge which is available already online within his diagnosis. Because for the patient, the diagnosis, that's his whole world. He's not interested in any other diagnosis or issues around it. He's just looking how to get healthy again. And physicians need to have some kind of horizontal knowledge. They cannot go such deep or such high, depends how you look on that, in the knowledge about one single diagnosis. The patient can, or his relatives who are taking care of him, they can. They are not interested in anything else. And we are already seeing this in clinical practice, especially in pediatry, because parents of the child patients, they are already knowledgeable users of Web 2.0, and my colleagues in pediatry are already reporting, and I'm quite sure that it will be the case in Romania as well, because we are seeing it across all developed countries, that in fact the caregivers of the child patients, due to the apomediation, are becoming experts, and they are able to have the expert discussion with the physicians, and sometimes they are even getting them a new knowledge which they recently found somewhere on a website, and at the same time they are asking the physician to use this new knowledge they found out somewhere for the treatment of the actual patients. And of course, a lot of my colleagues in clinical practice, they are not ready for that, because so far they were those who were telling to the patient what is right and how they should be treated. And so that's what we have to face in evolving Health 2.0 world. As you see, Intel is involved in most of the technical platforms which are enabling ICT. I'm quite sure that most of you knows Intel technology from laptops and desktops. So I would like to point your attention also to embedded systems like computer tomography or magnetic resonance. There are computers there which are taking the work, and our platforms are there to make the solutions running properly. And if we jump to the second end of this axis, we are also in a consumer devices like smart TVs, which are already getting the internet and the online knowledge even to households which so far were not using computers. And in fact, the TV is now merging more and more to be, how to say it, living room computer, which is gathering you all the entertainment which you used to have in normal TV channels, and combining it with all the entertainment and all the knowledge which is available online. Care coordination, that's a process which we are seeing is helping to improve the healthcare quality, healthcare spending, and also healthcare safety, because it's helping to circulate the information about the health status of a patient to be available on right time, in right place, for the right professionals to deal with that. In order to close this loop, of course, you have to start with gather and store all the comprehensive information. It's being already retrieved in various healthcare providers. And of course, it makes sense to start to sharing it, first of all, in the healthcare organization, like hospital information system. That's the example of sharing it in the organization. But it should not stop there, because you are then realizing just the partial benefits of the overall spectrum of benefits which ICT can bring. If you are able to mobilize the data, it means you are able to let the data flow across the healthcare ecosystem, that those professionals who are just dealing with some part of the healthcare delivery are able to get the right data. Then you can proceed to empowering the patient, to get him into the loop of delivering care, to activate him, to take care on his own health. And to share the responsibility for become healthy again. There are already a lot of systems also here in Romania which are great to cover this, let's say, first third of the overall loop. As I learned just today, Ministry of Healthcare will be announcing another part of this loop, the electronic prescription, which helps to get the data flowing also from the hospitals and the general practitioners or other specialists to the pharmacies, which is the next part of the common healthcare delivery circle. But to really make the patient benefiting out of this data flow, you need to put it into so-called personal health record systems where the patient can also interact with the information, and he can look when he's back home what was the physician suggestions. He can potentially jump to some website where he got more detailed information, how to change his, I don't know, food list to improve his health status. And you can also outsource some regular health checkups from the hospitals and GPs' offices to the patient homes, which is of course much efficient in terms of costs and also much comfortable for the patient, because he does not need to travel because of having a blood pressure measurement somewhere to the specialist and back. He can do it on his own at home. And when you close the loop, and that's what we are seeing already in projects of like Maccabi Health Service, which those of you who will be interested, we are happy to provide the case study, and I'll mention shortly some outcomes from the case study anyway. It's clear that if you want to start with clinical decision support, which is the interesting part for healthcare professionals, it needs to be that this loop is closed. In those healthcare provider systems where they were already able to close the information loop, they are getting already interesting clinical as well economic benefits. 70% increase in the number of women, about 50 who had a breast exam with mammography. It's just one of the very important results they have achieved recently in Israel in this Maccabi healthcare system. Also, you see the vaccination is being more prevalent and more people are taking that. If they are informed that they should take the vaccination because in their diagnosis it's really reasonable, it's increasing their, the safety of the care provided. Also, the hospitals within the Maccabi healthcare system are able to shorten the time, the length of stay of the patient, and even it can look like a very decent one. Those of you know how expensive is patient hospitalization, knows that even this can create some interesting economical outcomes. Yet another example of the tangible results which the home care delivery is able to provide. This is example from Veteran Association in United States, which implement home-based primary care. And they were able to reduce the total cost of care by 24%. They were able to reduce the hospital days, which their members are staying in hospital, by, in fact, 2/3. And they are also able to reduce with the technology the nursing home days by nearly 90%. And now jumping to the threats of the Health 2.0, or let's say the online healthcare environment, because as most of you know better than me, there is a jungle out there in the virtual world which is not safe, and if you are not equipped with good protection, you can be easily lost or you can be easily treated in the jungle. These are statistics coming from 2011 Internet Crime Report, which the Federal Bureau of Investigation is publishing each year. And you can see that these top 5 and major fraud types reports are coming with work from home scams, or some loan intimations. Also the crime which are being reported are usually related to identity theft or some advanced fee fraud. If we look more deep in these various cases and we consider the age of the online citizens who are being treated, it's also very clear that, for example, romance scams, I must say I did not realize that it can be such a big threat for people going online. But as you see, males or females over the age 40 are creating the majority of the online citizens who are being treated this way. And there are various reasons. One of them is that those who are becoming single in older age, they are just trying to look online for some other partner. And there are already a lot of people waiting for them to steal their personal information or to get their logins to the bank account, and of course playing the potential partner. Also, work from home scams are even more dangerous for males, as you can see on the right chart, because men's over 30 creates already like 2/3 of all those who've been threatened by this threat. And also impersonation email scams, which in this statistic goes from my FBI, but in Czech you can receive the email from Czech police, which is telling you that there are some issues with your bank account, so you have to provide some details. And of course, none of us sitting here will do so, because we know that our bank will never do such, or our police will never send us such email. But there is already a lot of seniors online who did not get this knowledge. So they are simply sending these personal data to the issuers of the scams. Well, and as we are thinking in Intel how to improve the user experience continuously, we know that no one is interested in bits and bytes and frequencies of processors anymore, how it was 15, 20 years ago. This has also changed, that now the end users, they are just they're interesting just at the end user experience. But end user experience is very much dependent on the quality of software and application. And of course, if you do not have a proper computing tool to be able to process all the applications and software, then the user experience cannot be good, because you are waiting too long. It's already a lot of studies saying that if the response of your computer is longer than 2 seconds, then majority of people are getting into trouble to continue in their task, because they are getting disrupted with other activities. So in fact, it takes them more time to do the task. If you lower the response time below 1 second, then the users are much satisfied, because they can do on the actual task, and when it's finished, they start with another one. If the response is longer, they start with one task, then start another one, then start another one, and easily get lost in what was the first aim of the task. And that's why we get back to one of our founders, who said in middle 50s that don't be encumbered by history, go and create something wonderful. In Intel, we have already a long track of creating new computing platforms which just push the overall ICT to yet another evolution level. In '95, it was the first multimedia processors which brought multimedia into the computing. In 2003, we started with Centrino mobile technology, which in fact created all the environment we are now using on daily practice. And in 2012, we tried to repeat it one again, and we created Ultrabooks, which are the new types of computing devices reacting to the actual situation online. There are being 200,000 laptops lost or stolen every year at European airports only. This is the statistic just from airports. So if we go to all the other environment where people are using computers, we will probably get to like one level higher of the number. And of course, the laptops, we are stored with all the sensitive informations which we are keeping on our hard drives. That's why we built in uncompromised security features, which are moving the protection of online citizens below the software level. Right now, all the antivirus, all the security applications are just at the software level. It means that your operation system needs to run. And also it means that those who want to threaten you need just to write some fake code. So Intel created a new level of security, which is already printed in the processors. So if someone wants to fake this level of security, he needs first to change the architecture of your processors. What is, of course, much more complex task than just to write some new virus, which can do each teenager, not each, but some genius teenager right now. And it's also being done right now by some teenagers somewhere across the world. But to print out a processor, you first need to build out the factory, which is printing the processors. So it's definitely not a task which a teenager can handle with. And we are also trying to protect the privacy data, which this Intel anti-theft technology is putting to the computing platforms of Ultrabooks, and sooner or later also with the normal laptops and computers which we are using. I'm sorry. Yeah. So also the Intel identity protection. It's the way how to protect people to not get lost their private data, even they will try to reply to one of these scams which I was mentioning previously. And of course we understand that at the beginning of all this transformation must be an education. Only educated consumers, patients, citizens can be aware about the threats and be aware of the methods to not being threatened by the threats. That's why we are creating a lot of platforms and we are giving them for free to our partners in the countries where we operate. One of them is School Healthcare Education. That's an online e-learning platform which is available for free. In Czech now we are signing contracts with GP Association who are going to use this platform for their continuing medical education. There is all the e-learning backend which is helping the content provider to track the exams and be able to issue credits and so on. And also we have created PC Basics, which is interactive tool, which works offline, or you download it and then you can run it without any connectivity. And it learns the first-time users some basics about the operational system, about the computer itself. It learns him some basic security suggestions which should be doing. And it's available already in Romanian language in various forms. There is special edition for teachers, special edition for small and medium enterprise, and special edition for general users. Of course, the content varies, but it's also learning the first-time users. What is it wiki? What is it blog? How the social networks are being operated. What are the common threats which you can face if you go to social networks and you are not aware that the people there can be trying to cheat you? Not all of the people being on social network are trying to help each other. So these are the tools we are trying to educate the ecosystem, the consumers, which should benefit from digital transformation of not just healthcare, but of the overall environment we are living in. And we are sure that these are the tools where it all starts. If there is proper education, then the people can use the technology the right way. Thanks for your attention.